right, I think we will get it started. Again, thank you so much for joining today. I'm sure it's been a long day for all, but we're really excited to talk to you about the new EVS system going live on August 12th. That is next Monday. And just want to make sure that we get you guys oriented to this new system and functionality so that you're ready to support patients after go live. For those of you who don't know me, I'm Amanda Hovermail with the Center for Medical Cannabis, and my coworkers Abby and Rebecca Brown are both joining me to support me. And also hopefully Kat if I go off the rails anywhere here. We'll start by talking through a little bit of the higher level stuff about the system. A lot does stay the same in the EVS. We are keeping the same URL. You'll still join at evs.utah.gov. The general workflow and statuses in the system look a lot the same. So if you are used to checking to see if a patient is in awaiting certification, that is the same. Hopefully, even though it looks different, it will feel familiar. We are maintaining still a full customer support team here at CMC. We will have people available by phone and email. We're ramping that up for the first few weeks of go live so that we can just respond more quickly if there are additional support needs. We are migrating all historical data from the old system. So if you're a registered patient now, you'll be a registered patient in come Monday. You'll use your same login information. Getting all that information pulled from the old system to the new takes quite a bit of time. So that necessitates the need to shut down the old system at 5 p.m. on August 11th. And it'll be down until 9 a.m. August 12th. So 9 a.m. Monday morning, we'll go live in the new system, and all that information will be there in the same status that you left it on Sunday night. You're still going to log in with your Utah ID. You're still going to make your payments online with GovPay. We are keeping the same fee structure for the medical cards. Basically, the EVS still does its important function of helping you manage your relationship with your medical cannabis patients. And the things that are different in the system is it is newly more mobile friendly. We know the clinics use it primarily from either a tablet or from a laptop, but patients are frequently doing it on their phones. And I know that's been difficult in the old system. So we're happy this will be a little bit easier to navigate from a small screen. We removed the pop-up for GovPay, which seems small, but will have a huge impact. When you click that add payment, it'll take you straight to GovPay. You won't have to help a patient turn off their pop-up blockers or fight through that on your own. We are also expanding access to the EVS so that medical providers and staff, and that includes the PMPs and pharmacy agents, will be able to assist patients with their payments. You can view a patient's information and their history prior to their certification. You can also directly help a patient register for a card for someone who is struggling with the system. And we're going to allow you to have more than 3 proxies as well for QMPs. Because we're expanding that system, and just for the most important thing we're doing in the EVS is protecting patient information. So it's really important that we know who is taking action in the system. So we want to make sure that proxies get registered if they're going to support patients. And we are kind of updating our internal guidelines. Customer support team will only be sharing information about patients with either a registered provider, their proxy, pharmacy agents, or directly with the patient. So if you have someone that frequently calls in for assistance from the medical cannabis hotline, make sure they're registered as a proxy so that they can have access to patient information. And if you need help with that process, please reach out to us. Changes for patients, they will have increased visibility to their purchase limits. You can see what you're allowed to access, what you're allowed to purchase for the month, and how much of that you have left. We know it's been difficult to see in the past, so that'll be a good thing to add. And new change is that we will no longer be sending the card as a PDF attachment to the approval email. You will get an approval email letting you know that you can log into the system and retrieve your card. But that, from a security standpoint, our privacy and security team at Department of Health never liked that. And so that is an update we're making since those cards go out with patient name and date of birth, and now they have a medical provider on them. It's just a lot of information about a person. We want to make sure that is kept safe. But the nice part is that QMP can help print that card out. The pharmacy or the pharmacy agent can help print that card out. So if patients are struggling with that, it'll be a lot easier to assist them. So I mentioned that Utah ID is staying the same. You do still have to register an ID or for a Utah ID to log into the system. And each user needs to have their own Utah ID that's linked to a unique email address. What will be different here is that you can help your patient submit an application before they get a Utah ID, as long as you sign them up using the same email that they're going to use when they do register for a Utah ID. They'll be able to connect to that application once they touch the system with their Utah ID and that email address. If a patient gets a new Utah ID, we know this is a frequent issue in clinics where they have lost access to the phone they used to have or the email they used to have. And they're signing into the system from a new Utah ID, they'll be able to connect their original application to their new Utah ID without calling the Center for Medical Cannabis. The registration information has to match so that it can make that connection. But that's going to be a nice change for patients that will not require assistance from the CMC team. And I will show that functionality first, since that's exciting and new. This is, we'll get logged into the portal. I'm going to sign in as a patient who's already registered in the EVS. I already have an application, but I am touching it now as with a new Utah ID linked to a new email address. So because this is a new Utah ID, it is going to treat me like a new patient, just like it does in the current system. I'll tell it that I'm a patient. I give it my last 4 digits of my social security number and my date of birth, and then I'll submit this. Instead of flagging me as a duplicate like it has in the past, let's see. It's going to notify me that this contact already does exist in the system. So it says it looks like you may already have registered with a different Utah ID. Your current email is this. Previously, you registered with this other email. It shows a portion of that. So if you've just forgotten that you did have that other email, you can switch and sign in using that other ID. But if you need to link to that new one, you're going to tell it we're going to use the current email to log in and click submit. And the system accepts that new email address and notifies you that it's updated the email, and it will, in the background, it's working to connect you to your new application, and it notifies you here on the screen that it may take 15 minutes for your application to appear in the portal. It's actually a process that's like scheduled every 15 minutes, so it may be shorter than that, but from the home page, you'll just be able to refresh your screen until that application connects and appears. If you really don't remember if you had registered before, patients can still reach out to us. But if it's just a simple matter of updating to a Utah ID, we're happy that we can give a little bit more flexibility for patients on making that connection. Let's switch now, and I'll show the system from the QMP perspective, since this is most of our audience today. This is the QMP homepage. It tells me here I'm logged in as a QMP. It also shows me my name. This is a QMP who also has a patient role, so I can see my 2 roles here, and I can click these buttons to switch between them. If I do need to register as a caregiver for my parent, I can add a role here down the road and switch between the 3 roles. But this kind of homepage for providers looks actually the same as what a pharmacist or a pharmacy agent would see. I have access to my personal application here. So if I need to do my renewal, if I want to update and add a new proxy, or importantly, end date a proxy who's no longer working with me, I would do that here on my application. And then, but we'll spend most of our time talking about these patient management tools, because this is what, the bulk of what people do in the system on a day-to-day basis. So from here, I can do a patient search. I can view my list of certified patients, and I can register on a patient's behalf, we're going to start with doing a patient search. This is where you'll start in most cases. I've got some test patients submitted. So just like when you do a certification in the current system, you'll be searching by first name, last name, date of birth, and last 4 digits. Oops. And click Get Patient Details to load that application. So in a change from the old system, now, even though this patient has never had a card yet, they're still awaiting certification. If I needed to help them, like correct their address or put their full, or fix their driver's license expiration date, I can do that here in the office while they're here with me if there's an issue with their card. If they're a renewal and maybe they're a new patient to me, I can look back and see their history, see how long they've had their cards, like when they got their first certification. I can look at their purchase history, and I can do that before I've connected with them as their QMP. But this one looks good, and it's ready now for me to add a certification. I want to talk through quickly a couple of changes to the certification form before I demonstrate that. So for the certifications, what stays the same is there still a patient limit. We are still setting the maximum number of active certifications that a QMP can have. That is set by the law at 1.5% of the active cards, and we recalculate that limit on a quarterly basis. That has not changed. We are still displaying the same list of qualifying conditions. And just like today, there are some patients who will need compassionate use board review if they're under 21 or if they have a non-qualifying condition. And that process hasn't changed. It's changed a little bit, but it's still required. And just like today, a recommendation or a dosing guideline is not required to get the patient certified. The things that are different in the system is that you will not be entering your PIN number on the certification. That's a change. We made it simpler for proxy to withdraw a certification that the QMP entered, or QMP can withdraw a certification that the proxy entered. We know that has been something we've stumbled with in the past, so that'll be easy for you to help each other manage patients correctly. If you do support a minor patient or someone with a non-qualifying condition through the Compassionate Use Board, you're going to complete that. You're going to complete that petition inside Salesforce. So you will not have to do a separate survey process. And we've also redesigned the recommendation tab in the system or the recommendation form to make it easier for you to restrict your patient's access. So the recommendation, the dosing guidelines, is used to restrict access rather than to opt them in. And then we also added a field that allows you to designate on the certification if the patient does require help to administer medical cannabis. We'll see that when we do the certification. So I'm going to click Certify Patient to move forward here. It knows me as the QMP that's registering this, and it's pre-populating the date for me. I'll select my qualifying condition and indicate whether it is a terminal illness or not. If I'm seeing this patient in like a more of a primary care setting and I'm able to bill patient insurance for this visit, I can mark that here. If that's how if your clinic can do that, then this patient, where if you get payment from the patient's insurance for a medical cannabis visit, then this patient does not count towards the patient limit. So in a lot of cases, we know that will be no, but some clinics are able to do that, and that's how you indicate that. Here's how you indicate the period of the card. So the state default is the 12-month card. That is the limit, but we know that there are some patients who need more frequent monitoring or a little bit more closer follow-up, and you can choose a 6-month or a 3-month card for them here. And if you're doing the acute pain card, that's still the 30-day card. The system will make that work correctly. But for this one, we'll give him his card for 12 months. And I am going to say that he needs assistance administering his medical cannabis so that I can get that field to print on the card. Click Next to submit that certification. and it lets me know that's been added successfully. And then view certification lets me just double check that information I just entered. If I realized right away that oh no, I shouldn't have done 12 months, this guy needs 6-month follow-up, I can use the change certification button to request that change. Or if down the road I determine that this patient is no longer eligible, or maybe there's an issue with him, he's not a patient of my clinic anymore, and I'm going to withdraw my certification, use the change certification to do a withdrawal as well. This guy is good. I feel good about this certification, and I just want to tell the pharmacy the restrictions of how I want him to be able to access medical cannabis. So I'm going to do that here with the recommend patient. Before I talk through that, I will talk about some of the changes to this form. Recommendation is still not required. Just like today, if you certify a patient, you are telling the state and you are telling the pharmacy that the patient is eligible to have the full state limit of 113 grams of flower and 20 grams of THC, the THC products, I guess, and they can use any dosage form. So if that's what you're fine with, and you'd rather that the patient just consult directly with the pharmacy to see what might work best for them, then you don't have to do a recommendation form at all. But some QMPs have, or some conditions, or it's important to have a little bit more guidance there, and you can use this recommendation form to enter that. You can give the pharmacist the ability to override that recommendation without calling you, or you can restrict that. And you can also share notes with the pharmacy in the other dosing guidelines field. What changes in this new system is that we have redesigned this form to more consistently restrict access to the products that you don't want the patients to have. And so to do that, we are having you opt patients out of categories instead of opting them in. This was a frequent feedback that people didn't want to have to check every single product form to say they're allowed to have all of them. So if you want them to have all of them, then you just don't choose any restrictions. Opting out of those categories will hopefully will be clear and easy to understand. We do have a slide in this slide deck that talking through those limitations if you want to dig into that a little bit more. To simplify, when you're renewing a patient, it's not going to pull forward an old recommendation or an old restriction from the last time you certified the patient. Each time you certify the patient, you'll say whether or not you have any dosing guidelines. If you do, then we're not pulling back any historical information that maybe doesn't apply anymore. On the other dosing guidelines field, just to let you know, there is a 255 character maximum, and that's because that field is passing directly through to the retail point of sale at the pharmacy. And so there is a limit to what you can add there. So you want to just give a short message to the pharmacy about maybe particular types or strengths that you're hoping the patient can use for their condition. And even though we did say all information is going to be migrated to the new system, there is a little caveat about the recommendations. In the old system, there is a lot of that form has been used very inconsistently and very inefficiently. And so we've had to do a lot of cleaning and streamlining to make that make sense, to transfer that over to the new system. We're trying to make sure that anything we move over, because it will be a hard stop at the pharmacy, and we want to make sure that anything we move over is a true restriction. One example of this is, because you have to choose at least one dosage form to enter a recommendation. So a lot of people just checked the first one on the list, which was aerosol. And then they would use the notes field to say, okay, you can use any dosage form. But the way that we had built that, if you just say aerosol, the new system would have restricted that. So we want to make sure that you're truly, if you have a true restriction, we're capturing it appropriately. If there's someone specific that you know that you had restricted, or feel very strongly about the products they access, you may want to check that patient after go live and just make sure it looks the way that you expect. So let's look at this in the system. I'm going to confirm here that I have dosing guidelines for this patient. And this is what the recommendation form looks like. I have my QMP number pre-populated and the recommendation date. It also preloads the state maximum for the 113 grams of the monthly flower dosage and 20 grams of the composite THC. Um, if I have product categories that I really do not want this patient to access, I'll use this restriction field to indicate that. Um, I know in some cases I talked to a provider that had a patient with dementia, and they were really worried that if the patient had edibles, that they might get perceived as candy, and so they were okay with the pharmacy doing anything except for edibles. So let's do that for this patient. And we'll also say that he's new to cannabis. We want to make sure he's starting slow. So I'm going to give him half the state limit here. So I'll change that to the 56 grams and then 10 grams of the composite THC. This other dosing guidelines field, this is where we have the 255 character limit, and you can give a short guidance to the pharmacy if there is like a certain preparation or a certain strength or a certain ratio of product that you want that patient to have access to. But again, this is for a very short note. If you have a longer message, information about the patient's medication and treatment history, you would use this medication and treatment history field here to do. If there's this is information that you would want to communicate that is pertinent to their medical cannabis treatment, something that you want to make sure the pharmacist is aware of as far as a contraindication or a medication that there might be an interaction with, or other information about the patient's medical history. That goes here in the medication and treatment history, and that is kept solely in the EVS. So the pharmacist will have to look at this in the EVS. And we make this available so that you can share that information with the pharmacy, but it is not a substitution for your electronic health record that you use to keep track of your own patient records in the clinic. I'm going to mark yes that I do authorize a therapeutic substitution. Actually, no, I'm going to say no. I really don't want him to have the edibles. So I'm going to make that change. I'm going to make that firm and say no to that. And I'll submit this recommendation. So even though this patient hasn't paid, this card isn't active yet, you can see that the system has set this total, these dosage quantities. So here's my total, the 10 grams of the composite THC products that's allowed, and the 56 grams of flower. You can see that because I haven't made any purchases yet, that full amount is remaining here. So that'll update as the patient makes purchases. But now I can see that this patient is in the awaiting payment status. And if this guy is great in the EVS and already logged in and ready to go, he can log in and make that payment in his account. If he needs assistance, or if he's just sitting here with his debit card, I can also help him add a payment right here while we're in the room together by clicking the Add Payment button. And it takes me straight to GovPay, and we don't have the pop-up, and we're so pleased about it. I'm going to use a test credit card to pay for this. The name and the address information is not being pulled from EVS currently. So that's a change, but shouldn't take too long to flood in. You do want to make sure, though, if they want an email receipt, that they do plug their email address in here. Okay, continue to submit that payment. Click yes, that the information looks correct. And once that payment has processed, I can also print this as a receipt, but some people still like the email. I'll click continue to go back to that patient application. Actually, back to the home page, I misspoke. So I can look up that patient right away by searching for him again, or maybe simplest would be for me to look here in my list of certified patients. I can see him here at the bottom. We were working on Peter Pan. He's already in active conditional status, and his patient number here is a hyperlink for me to open up his application again. So while he's here, if he doesn't have a printer and he'd like me to help him print that patient medical card, I can do that by clicking patient medical card. And this is what that card looks like in the new system. Mostly the same, but configured just slightly differently. We're capturing all the same information. We folded it in the middle instead of top to bottom, and it's not working correctly in the test system, but the provider, the QMP name will print on the card. That's a helpful thing for the pharmacy to be able to see. Here's that assistance required field that prints on the card if the patient does need help administering medical cannabis. This is not the same as having a caregiver. And then we've added a QR code. So the QR code will be helpful at the pharmacy or the clinic if you are signed in and you have access to EVS in a role that allows you to view patient records. If you scan this barcode, it'll take you straight to the patient application. So let's look again quickly at this list of certified patients. So one thing that we already have a bunch of enhancements planned for, because this page is not as functional as we'd like it to be. Right now, the only option for sorting is to sort by the certification status, which we know we need to improve. And because these are just recent test patients, all of mine are active. But if I was looking specifically for a renewal or someone that I've seen before that had expired, I could search that way. Also, this view is paginated. So for those of you who have a lot of patients, you would tab through that. You can do Control F to do a find. But for me, it was simple that this guy was right at the bottom of the list. But we will be working to improve this page and make sure that providers know when that's available to them. I do want to show one more new feature that's available to QMPs, praxis, and pharmacies. And that's the opportunity to do registration on behalf of a patient. So from the homepage here, I have register for patient. Now, best case scenario is always going to be that the patient does their own application. We will teach them to fish instead of giving them the fish. But there are patients that really do struggle with technology. They may have vision or mobility issues that make it hard for them to do this, or they may just be really ill. And those are that's the perfect opportunity to help someone with their application. Ideally, they'd be with you while you did this so that you could make sure that all the information you're entering is correct. But we'll just play with entering a test patient. I think since I did Peter Pan, I'm going to do Wendy Darling. And you do have to have an email address for the patient, but they do not have to have a Utah ID for you to be able to help them with this. So that submits their registration information, and then I can start their application. I know it's ideal if people show up at the clinic with their application submitted, but sometimes that just doesn't happen. This gives you an opportunity. And this looks very much the same as what you've seen in the current system. It's collecting the same fields. All right, so I've got that captured. I have the opportunity here to indicate if they want to have a caregiver support them with their application. This does not replace the caregiver application. This is just where the patient says this person is going to serve as my caregiver. The caregiver will get an invitation to apply to the system after the patient card is active. But this is step one, is listing the patient's caregiver here. Also, if they're a patient in a nursing care facility or assisted living, you can list that facility name here. Most people we know don't need these fields, but they're available for each patient as they come through. Here's the patient acknowledgement. If the patient is here with me, I want to make sure they know what they're agreeing to here in the system. We've always been really careful about not really acknowledging on anyone's behalf without their knowledge. So I'm going to click yes, patient's okay with this. And this is a new option as well, that you can opt out of medical research. In the past, the acknowledgement indicated that you had to email medical cannabis at utah.gov to let us know if you wanted to opt out, but now you can check this box. if that's something that you're concerned about. But Wendy Darling feels great about medical research. So I'm going to leave that and submit for certification. So this puts her right into that status where now the application's ready and we can get her certified if she's here in the office. So I think I'm going to log out of the QMP. Oh, wait, before I do though, just like in today's system, if you do have additional information that you need to communicate about this patient, you can still use notes to give the PMP information about your patient. It works just the same that you click plus new to add one and enter your note here. One change is that we're not giving you the opportunity to add a file to this note. That may change in the future, but right now this is just a note. If you have documents that you want to upload, you might want to use the note to say, I've uploaded a medication list. And then I'm going to just cancel this note, but files and any previously uploaded information that was attached to a note will be available here on this Files tab. And that's where I could upload a new one for this patient. Maybe I have a full medication list or something that I think would be important for the pharmacist to look at, and I can do that here. Okay, so now I will log out. I'm going to log in as a PMP, just so we can see that slight difference for the PMPs that are registering patients or helping patients that are being certified by the limited medical providers. So you can see here I'm signed in as a PMP. This looks very much the same as a QMP application. I manage my own application and my renewal and my fees here in the My PMP application. And I have the same patient management tools. So let's search for Wendy Darling here. Hopefully I remember what birth date I gave her. So this is the patient we just applied on behalf of, and she's in the waiting certification. So she's ready here. If the LMP's office has faxed me over that limited medical provider recommendation form, I can go ahead and enter that for this patient by clicking the certify patient. And we want to coach you guys to always start by checking the existing. So instead of entering all the demographic information for an LMP each time, best practice will be to click existing and search by the controlled substance license number. This little tooltip here reminds you that's what you're using to search. But that way, if you've already worked with this LMP in the past, they'll already be in the system. Maybe even another pharmacy has done that before. But I'll be able to search by their controlled substance license number and find them in the system. And then I won't have to re-enter all their office information each time I certify that patient. So it found this one for me. If it did not, I would use the new button to enter a new certification or a new LMP listing. And then the certification looks very much the same. I'm going to choose hospice patient on this one. Because it's a terminal card, she gets a 12-month card. So I'll click that. And then the other thing we've integrated into this certification process for the PMP role is that you'll just upload that LMP form here using the upload files. So you don't have to enter a separate note for us. Just grabbing a PDF here for testing purposes. And now that's uploaded and I can submit it. Maybe. There we go. Okay. So that takes me back to the certification, just like before I could I could do that recommendation if the LMP had given me specific information about this. But if this patient was in the office with me and now she's certified, I could, just like we showed for the QMPs, I could help her with the payment, or I could have my pharmacy agent do that part, and I could help her print her card so that she's ready to shop that day. So that is pretty much what I wanted to cover as far as new features. Let's switch back to the slides and just kind of check in on kind of the go live process here. So we are finishing up. This is our 6th provider focused webinar. Actually, maybe we ended up doing more than that. This is the final one. We are going to be making sure this training documentation, the whole slide deck, even some that we didn't cover today, and the video walkthrough will be uploaded to the website. And we're continuing to make updates to the CMC website so that you have updated information about the program and the go live. I'm going to just quickly show you some changes on the Center for Medical Cannabis website. We got a big notification here about the blackout period because no one will be able to sign into the system Sunday night to Monday morning, which means no one can register, no one can sell. But for additional information about the new system, we have put this EVS hub on the homepage. And it's got some high-level information about the changes that are coming. It's got new FAQs, and for FAQs for like general, for the patients, for the pharmacy medical providers, and the medical providers. This is the slide deck that we worked off of today. Again, there's more information in there, and there's a lot of like short little bites that may be useful for patient guides that you might want in your office. So I encourage you to look at this, and it's got screenshots of different steps. And we wanted this to be like little chunks so that you can easily walk patients through things. Or if you're helping train a new employee in your clinic, this will be a good guide as well. So we'll look here for the recording. We'll get that added hopefully tomorrow. And really next step is coming fast, is that August 12th, the new system will launch. And that first month after go live is called hypercare. And what that means is we have like additional technical and customer support from our vendor, so that if anything is not working as expected, we can respond really quickly. And then the most exciting thing for us is that we are able to make ongoing enhancements to the system. So if we notice a little thing that isn't working correctly, or a feature that a lot of people keep asking for, those improvements that we talked about to the certified patients page, we now have like more access to make those types of changes ourselves. And we'll be grateful to get feedback from users as we go through this process, so that we can consider some of those suggestions for implementation. We won't always be able to implement everything, but we're going to continue to learn as people start using these new systems. We want to make sure it's as clear as possible for patients and providers to navigate it. So any enhancements that come to the system that really affect functionality would be either announced in our newsletter or possibly with other trainings, but that'll be a really good thing that we can do in the future. So that's all I've got. Are there any, if you have questions that I didn't address in this training, we have a Q&A feature at the bottom of the Zoom, and happy to answer your questions if I can that have come up as you've watched this.
So we had one question that came up in the middle about the difference versus edibles and oral preparations.
Oh,
so we've answered that one in text,
okay.
So we won't make you read it out loud, but that one's there. So anyone on the line, feel free to take a look at those. We have a question. If the QMP checks the OK for pharmacists to change recommendation, is that for the formulation or dosage form, and also for the limits?
I'm not sure I'm 100% prepared to answer that. I feel like the way the law is written, it would let you also make that type of an adjustment to the quantity, but the system won't override that with that current recommendation in the system. Like the the point of sale is going to enforce that 56 and 10 if that's what's in there. So if you're making that type of a change, you actually would have to inactivate that recommendation and put a new one in. I feel like increasing the limit is something that probably PMPs generally would consult with the QMP about, but I think according to the law it may be allowed. I'd have to actually double check that. Primarily that's used for the dosing forms. Like if you specifically say, hey, I want this person to have a tincture, like an oral preparation, but they're finding that they're just not getting the right kind of relief, or they're not able to get the strength or the type of product that they need, then if you've authorized that, then the pharmacist can easily make a therapeutic substitution saying like, yeah, I think this might be a better match for the goals that you have and for the symptoms that you're trying to treat.
Perfect. We have a Utah ID related question, I believe. Okay. Can we switch to the phone number for one-time security? Can we switch to using the phone number for one-time security code after sign-in? As a pharmacy agent, we sign in often, and it always only allows email.
Yes, so you can do that. You just have to add that to your Utah ID account. So you can do that at id.utah.gov. Sign into your Utah ID, and you can manage your own account and add a phone number. I did that today because I was fighting the same thing with one of my test accounts. But yeah, you can add your cell phone number, and then you can get those codes texted. It seems like for a lot of people that's just simpler. Especially, I feel like Utah ID has always struggled with the emails for people who have like an old live.com. Sometimes the AOLs, they just don't get their email. I don't know why, but adding that phone number is a good trick. It unfortunately, like when you create a new account, as soon as you've added that email, it kind of is like you're done. It doesn't prompt you on that. You can do it at any time though.
Perfect. We have a question. How are pharmacies supposed to manage patients who do not know their social security numbers in order to check their limits? As a pharmacist, respectfully, many of my patients are unaware of what medications they are taking, let alone their social security numbers.
So I know that in the current system, pharmacists don't have to always have all 4 of those pieces of information to look a patient up. And we've had that feedback already from some early testers. So that is something we are looking at simplifying, especially particularly on the pharmacy side. I'm aware that, like maybe you have someone that has just registered for their first consult. They've not been in yet. You have a little bit of information about them, but not everything yet. And you want to be able to look them up in the EVS. We plan to expand that functionality, particularly on the pharmacy side.
Here's a fun one from an anonymous attendee. When is the next increase in patient limit?
That'll be September 1st. Wait, when did I do it? July? Maybe it's October 1st. Yeah.
Quarterly.
Quarterly. Quarterly, and we always do put that in the news in the newsletter. So as far as we know, without any other changes from the legislature, that'll be the next time. I think it's October.
So another question, if you are doing the registration and payment completely for the patient, at what point do they register for their Utah ID? I help a lot of elderly patients where I process their entire card for them, including in the past creating their Utah ID and application. With us having more ability to do that now, where does the Utah ID come in?
Yeah. So I think for some of those elderly patients, like if they never need to sign into their own account, you may not do that. But that's an option. And for most people, it's the best option so they can sign into their own account. You can submit that application without it. And then if, once maybe you guys have got through the process, they've got their card, but later they want to sign in and see their patient limit, they would need the Utah ID at that point to access the system. But the improvement on this is that instead of you creating a Utah ID for a person and then doing that sign in and registration on their behalf, when you do that, it looks like the patient did it. the way we've set it up now, we can tell that it's the pharmacist that did it. We can tell that it's the QMP that did it. So we have the ownership of how that record was created, and that's safer and better for patients. So if there are definitely situations where they're not gonna need a Utah ID to get their card, but as soon as they want to log in on their own, they would need that.
We have a follow-up for the Utah ID, and I think we're happy to direct you. They have a decent amount of documentation on this. So where can you add the phone number for Utah ID security code? We haven't been able to find the link. It doesn't allow the option.
Okay, I'll just share a tab because my test account had it. I did this today. But yeah, so I'm signed at id.utah.gov, and the phone number goes in the home information field. So this is where don't look at my phone number, but this is where you do it. So if you want a text code, add it to the home information, and you can put more than one cell phone there. So.
Perfect. In EVS, all right, the next question was in EVS, it clearly asks for name, date of birth, and last for a social. So how will we search for them? And I think this one we answered already, but you would need all four to be able to search for the patient. I think the other alternative is if they have their patient card with them, that QR code, if you scan it, will actually take you directly to that record. So that's a good way to but to able to easily find those patients without the QR code.
Yeah. And like at the pharmacy level, I mean, you also have your point of sale to be able to check them in with the patient card number and the date of birth. So you can pull that information over as well. And what we're going to do at that time when you check a patient in is send over, yes, they have a valid card. Here's when it expires. And we'll also be sending over those patient limits so that you have that right in front of you, the true limit of what the provider has allowed that person to have.
And then one more. So what is the protocol if we cannot establish the Utah residency? Not sure if a patient is a Utah resident or an out-of-state traveler vacationer.
Yeah, so I guess the way we look at it, the way the law looks at it is you can apply as a Utah resident if you have lived in the state for 45 days. We don't do validation on that address. So that is self-reported. But if they are applying as a non-Utah resident, then they have to have their card from another state to be able to be eligible for that visitor card. So they would do the non-resident application and enter their address from their home state and their card from their home state. Those people don't get certified by a QMP. We rely on their card from home as their certification to give them that 3-week card. So we do sometimes have people who have moved to the state who are new, and they'll be like, well, I had my card in California. Am I a resident? Am I a non-resident? And since the law sets that 45 days, sometimes we've advised patients like, we'll go ahead and get your temporary card and as a non-resident, and then you can switch your application once you've been here at the 45 days. It gives you a little bit of time to find a QMP and figure out where you're going to get your card from. You can have your temporary card, and then you can switch your application and be a Utah resident once you've lived here long enough.
Why are you increasing the number of proxies?
Mainly to encourage people to be signed in as themselves, and so that we always have that transparency into who is taking action in the system. Also because we're changing an internal policy of that if you call in and need information about a patient, we are going to make sure that we are talking to a proxy who is truly able to access patient information in the EVS. So I'm actually not sure. The law never set that limit as 3. That's just how the system got built. But it was a struggle for some clinics. That's just not the way some clinics work. So this will be better in that we can always tell who's signed in, that they can be signed in as themselves doing their own work. And especially when they're touching a patient's application, it's important to know who did what.
And this is a good one. Is there any ability for us to have the patient's card go active if they're expired and renew with us, or do they still need to wait or call the hotline to get that to go active?
This must have been a real pain because I think we've had this question in every training. But yeah, so if they're coming out of a closed state, if they were previously expired or canceled and you renew them and they pay their fee, they will be activated right away and you'll be able to help them print their card. We no longer have that 8-hour limitation that the current EVS was doing. The renewals for patients with active cards will still work the same way. They'll renew and they'll get an email from us that their renewal is complete, and that letting them know that the new card will be available after the day after the current expiration date. But for those who had previously been closed and are getting reactivated, they'll have their cards right away. So hopefully that will save some trouble.
Perfect. And can the temp card for non-residents be done same day?
So sometimes, yes. Actually, a lot of times, yes. It is just something like we do a scan for them in the morning. We usually look at like each one that's come in and we approve anyone that's come in. But if someone has applied throughout the day, you would need to call in and say, hey, I've got it. Pharmacies call me about this all the time where they're like, hey, this person just paid for their card. Can you check it and see if it is able to be activated? And so we do have a process of what we need to validate on that out of state card, and we'll check that. And if we're able to approve it, then we are happy to do that. One limitation there is that can only happen when someone's working at the Center for Medical Cannabis. So that is Monday through Friday, 8 to 5 is that we're able to approve those. That doesn't happen on the weekend.
Then final question, why was the patient limit established in the first place? Can a QMP cover more than one medical office? So 2 questions there.
The patient limit was established in the first place because the legislature had a real concern about clinics kind of just functioning as what they sometimes call like a card mill. Like they really want this program to be a relationship between a provider and a patient. That's the intention of a medical program. And so the legislature had concerns about kind of having a lot of those just like huge clinics that are certifying everyone. The other reason is that they want to I think there's concerns also about affordability, and that's why that they've put that limit or that option that if you are going to bill a patient's insurance, if you're functioning as a normal clinic that's doing a normal office visit for an established patient, evaluating them for chronic pain, you can discuss medical cannabis as part of one of their treatment options and bill their insurance for an office visit, just like you would for any other office visit. And then and they just wanted to incentivize that, and that's why those patients don't count against the patient limit. But that's been, I know there's been industry questions about whether that would change, and it's changed quite a bit. The default used to be 275, I think, and then specialists were allowed to do up to 600. So it's gone up quite a bit. We may see it change in the future, but that has been set by the legislature.
Then can a QMP cover more than one medical office?
Yes. So we do have several QMPs in that situation. In your QMP application, you can list more than one office location if you want to appear on the medical cannabis website, that you see patients maybe you see them in Provo and you also want to show your office in Salt Lake. You can publish both of those locations to the medical cannabis find a provider page. But yeah, there isn't any restriction on where you see those patients.
Perfect. And that is all the questions we currently have.
Great. Well, we went straight to 5:55. Maybe we'll give it another minute to see if anything else comes in. But otherwise, watch this hub page for the video to get posted. If you have someone in your office that didn't have a chance to join any of these trainings, please encourage them to reach out to to look at this and get familiar with that so that everyone's ready on Monday. We will be available by phone and email to help with anything. And we're sure excited for everyone to get in and start learning and using the new system. Okay. Thanks, you guys. Thanks for joining.
Thank you.